Good day, all, and thank you so much for joining Chom's MediHelps Foundation in its first annual Black in History Month event. I was reading somewhere that Carter G. Woodson, who is who we actually acknowledge. I'm not gonna say think, who we actually acknowledge as the inventor of Black History Month, asked, "Why is it Black History Month and not Black in History Month?" And as I said from day one, we, in the African American community, it's one of the ones that we as the foundation serve. We serve our African American people. Why? Because we come from them. And so our ancestors originate from that African American culture. So with that being said, it's time for us, like us. When I say us, I mean African Americans. It's time for us as African Americans or as Africans, right? It's time for us to step up and show the world what we're made of. Show the world what our ancestors birthed into us, the gifts that they birthed into us, and how they raised us to not only share that gift of oneness, but share that gift of inclusiveness, including the community, and making sure that those who don't have or are now in the same social economic status as we are, making sure that they know that we exist. Why go to another neighborhood or go to another culture to get services when you could get those services right in your own community? It doesn't mean, anything more than we as African Americans in the healthcare field, we need to be striving and stressing to make sure that amongst all the resources that our people know about, they know about the resources that we offer. They know about the resources that we want to extend to them, and that we're willing to work with to make sure that they are able to access those resources. In accessing those resources, they are accessing the best of the best. And how will they know if it's the best of the best if we don't tell them? Well, that's what this African American month is all about. This African in Health is all about this month, is making sure that everyone, especially the African American patient and the African American patient community, know that yes, we are here. Know that yes, we are able to do some marvelous and miraculous things when it comes down to healthcare. And so that's what this month is all about. Today, I bring forth Dr. Kafilat. I'm gonna let her go ahead in her presentation. I'm gonna go ahead and let her not only tell us all about preventative care, but also tell us about herself. Also, that her light shine in the gifts that she has, and why she's a senior subject matter expert when it comes to the health field, and how anyone and everyone can access the services, the many services that she offers for that one goal that Chom's MediHelps Foundation has in mind and has in its mission, which is to ensure not just healthcare, but to ensure the best healthcare outcomes for communities such as ours, which are under resourced and underserved. So, with that being said, I'm going to go ahead and turn it over to Dr. Kafilat.
Thank you so much, Miss Sandra. Thank you for inviting me on this to this important educational session. And thank you guys for being here and listening. I know this is pre-recorded, but if you have any question at the end of it, once it's posted, please do reach out to me. Miss Sandra will let you know how to get in touch with me. I think at the end of this presentation too, there will be some information on how to reach out to me. So today we'll be talking about preventive care. A little bit introduction and background about myself. I am Dr. Kafilat Salawu. I'm a doctoral nurse practitioner, a board certified health advocate, and the founder of Fides Health Advocates, where I serve as a liaison between patients and their healthcare professionals. So what does that really mean? I don't know if you guys have ever been to a doctor's office or a provider office where you just feel like people, or been admitted in the hospital and you just feel like people are just coming and going, nurses are coming and going physicians are in and out, and you don't truly understand what your diagnoses are, you don't understand what your treatment plans are, and things like that. So that's where I come in. And my background is I've had quite a diverse background professionally within the hospital, in the community setting as well. But my experience as a patient, caregiver, community educator, and my expertise as a family nurse practitioner in hematology-oncology, which is basically cancer and blood disorder, nurse practitioner, has significantly informed the kind of care that I provide and the kind of advocacy that I charm within the healthcare space. I got into this space basically because of my own family members' experience. My younger brother, decades ago, had some significant health challenges, and I watched my mother and my father go back and forth doctors' offices without. They had questions. They had some questions that at that age I thought were good questions, but they didn't get the right answer to their questions, and it was a lot. There were a lot of challenges with them communicating with their healthcare professionals. I knew right there and then that I wanted to be a healthcare provider. um, would that be a doctor, would that be a nurse practitioner? Of course I didn't figure it out. I was about 6 7 years old at that point. But thankfully, I've had my own journey, and I'm still passionate about healthcare, and I'm passionate about helping people find the right care and helping them achieve the best outcome, especially our people, or underserved population. Enough about me. So, learning objectives for today: educate. My plan is to hopefully educate you on the importance of preventive care, especially within our community. Increase awareness of the roles of independent health advocates, and explore significance of preventive care. How being focusing on preventative health care can hopefully lead to a healthier and happier lives for you and then for the community. So we talked about preventive care. What really is that, right? It involves a lot of measures to prevent illness or prevent complication at an earlier stage. It includes not it's not limited to, but it can be. It kind of encompasses vaccinations, screenings, regular checkups, and lifestyle modifications. So when I say lifestyle modifications, what are we talking about? Eating right, right? Not smoking, exercising, things like that. Being able to be proactive about your own care and really staying focused on or enlightening yourself about your family history, your background. What, say for example, your parents were diagnosed with hypertension or diabetes around the age of 40. What are you supposed to be doing if you are in your 30s or in your 20s to hopefully prevent things like that, diagnoses like that from happening to you, or you getting the same diagnosis? Um, so, the impact of preventive healthcare. Our goal is to improve our quality of life, right? And how do we do that? So we improve our quality of life by really looking into risk factors. I gave an example of hypertension and diabetes earlier. Is that something genetic, or is that something that you could certainly modify? When I say genetic, is it something that you don't have control over? Or is the diagnosis of hypertension or diabetes something that you did or you could improve on to hopefully offset that diagnosis? Now, what am I talking about when I said that? A lot of us eat however way we want just because we enjoy food. It brings us joy, it brings us happiness. But does that mean that we should kind of go rogue about it? No. I love chocolate, I love good food, but moderation is the key, right? Um, we all know that eating too much carbs, especially simple carbohydrates, does not help us especially if you have a diagnosis of diabetes. So kind of cutting back on that. Soda, sweets, things like that, you want to cut back on significantly. Exercising, very, very important. Preventive healthcare can also kind of help you prevent or cut down on medical debts. So what are we talking about? For example, somebody who has a high chance of developing diabetes or hypertension. When you have those diagnoses, then maybe a decade later, at some point, that's going to increase your risk of developing like kidney disease, heart disease. Uh, so you being more aware and more cognizant of your health could hopefully prevent complications like that in the future. Longevity, right? Regular screenings, again, being more advocating for yourself, learning tricks, and being aware of how to advocate for yourself. Uh, I usually use an example of metformin, which is the medication that a lot of people take. If you have a diagnosis of diabetes, or you have a high chance, you have maybe overweight, and you have other things that could potentially increase your risk of developing diabetes, a lot of providers prescribe these medications. And for most people, they take it for over a decade. Now, what we know is once you are on metformin for a long time, you can potentially develop like kidney disease later on in life. If you don't know that, then I, what I would say is medication is not food. It's supposed to help to take the edge off, right? So if you're relying on medication to help you fix all of the problems or all of the health problems that you have, I think you're on the wrong path. So medication is good. We've come a long way in medicine. However, you have to do the work as well. So living knowledge is power. Living longer is our goal, and being healthy while we live longer too is should be our mission. So within our community, it's not just this is not just an individual work. It's something that we need to work together as a community. Building a healthier community definitely will help to reduce the amount of work or the intensity of work that your healthcare professionals have to do. So, what do I mean by that? If we have within a community, say like 10,000 people live in a certain community, and we have 50 of them who are unhealthy. It's a lot. It's easier to manage. It's easier for your healthcare system, the healthcare system within that community, to manage 50 people who are sick versus a community that has majority of unhealthy people. Uh, so 50 versus within 1,050 versus having 5,000 people who are unhealthy. So that puts a strain on the healthcare professionals, on the healthcare system. So things like that, you have to do your part. We all have to do our part. Be healthy. Again, exercising, uh, improving your eating habits, lifestyle modifications for sure. So I put this on because I'd like to kind of dial back a little bit. A lot of us have healthcare professionals that are not our ally. Your healthcare professionals are your ally. When you have to do your part, but they also have to do their part. If you don't trust your healthcare professionals, then how can you collaborate on your health? It is your healthcare. You matter. You have to speak up for yourself. So let's give an example for this particular one. If you have a if your healthcare professional asks you a simple question such as, "Do you drink alcohol?" and you feel like you have to lie to them, then that's not a good relationship. You know, um, if you feel like you have to lie, then there's something you already know you're doing something wrong. so so those are the things that you want to change. Now, for me as a nurse practitioner, sometimes I ask people questions not because I want to get into their business, but because I want to know how to best take care of them. For example, going back to that alcohol example, if I have a patient who has high cholesterol and I'm asking you, do you drink alcohol? And you're telling me you don't drink alcohol. Okay. Well, and I ask you a couple of other questions, you said no. That is telling me as a provider that I can prescribe any kind of medication that I feel like would benefit you. Now, if you drink alcohol and you tell me that you don't drink alcohol, some of the medications used to treat high cholesterol also has an impact on the liver. just like the alcohol does. So if you're a heavy drinker, and then you get those kind of medications, that means we're putting a lot of strain on your liver, and we can cause damage to your liver. So again, it's a very, very important for you to consider your healthcare professionals. This is not just your primary care doctors. We're talking about your nurse practitioner, your PA, and if you go to the pulmonologist office, if you go to the heart doctor's office, all of those are considered your healthcare ally. If you work with an advocate, a health advocate, again, all of these people, your family member who help you with your healthcare journey, all of these people are your healthcare ally. You should be able to kind of rely on them, trust them to a certain extent. So education and counseling. Again, your primary care providers, all of your healthcare providers, play a crucial role in educating you, especially your primary care doctor. Again, focus on making them your healthcare ally. Those are the people who will talk to you about your screenings, about your vaccinations. And if they're not talking to you about things like that, then maybe it's time to have a conversation about, are they right for you or are you right for them? So key components of preventive healthcare, again, vaccinations, screenings. But now I know a lot of people have their reservations about vaccinations. Um, I'm not gonna say you have to get vaccinated, but I do want to talk about the importance of vaccination. Again, the community, it's not just about us, it's also our community as a whole. What are we doing to improve the health of our community? What are we doing to improve our health, right? Screenings. Are you up to date on your colonoscopy? Are you up to date on your so for somebody who has immunosuppression, such as lupus, right, or currently is battling cancer, have you had your pneumonia vaccines? When was the last time you had your cholesterol checked? Yeah, we feel well, but you feeling good doesn't mean that everything is all good. You have to get your kidneys checked. You have to get your annual screening, blood pressure, your blood sugar levels, things like that. Healthy lifestyle, living a healthy lifestyle. I'm encouraging you to exercise regularly. How much exercise do we really have to do? I know a lot of people talk about exercising. The current recommendation is about 30 minutes most days of the week. Vigorous exercise, 30 minutes. Now, I know some people can't walk a lot or can't do vigorous activity. If you're somebody who is very limited in what you can do, it doesn't have to be a marathon. You can do stuff like anything that's going to really jumpstart your heart rate, anything that's going to make your heart beat a little bit faster than your baseline. That could be considered an exercise. So I want you to talk to your providers, and that could be something as easy as grabbing a water bottle or like a filled cup and raising it up, up and down. For some people, that's a form of exercise because it increases their heart rate. So it doesn't have to be, you don't have to go to the gym to make that. Regular checkups. Again, if you have blood in your stool, you need to talk to your providers and make sure that you're getting screened. If you're having frequent headaches, symptoms that is not usual for you, that is not considered normal for you, you need to be talking to your healthcare providers about them, right? Again, education, knowledge is power. Knowing your background, knowing your own health, what's normal for you and what's not normal for you. Now, when I say what's normal for you may still be abnormal, symptoms. So again, it's important for you to be honest with yourself and also be honest with your professionals. So again, let's take charge of our own health. No one will advocate for us the way we would advocate for ourselves. Okay, so if you can't take care of yourself, no one will take care of you better than you would take care of yourself. Now, let's encourage each other to, again, live a healthier life, be more proactive about our healthcare. be more understanding of our own body. In summary, before I actually go into the summary, let me talk about some of the, even though I don't have that on my slide, I also want to talk about like ways, some of the ways to hopefully advocate for yourself. Now, when we're choosing our insurance, this is one of the ways that people end up in medical debts, or they end up being overwhelmed or not getting the care that they deserve. When you're choosing your health insurance, make sure you're paying attention to what your insurer is going to, what kind of benefits your insurer is offering. Um, are they offering any home health assistance? Because you might think that you're healthy right now. Anything can happen to anybody, even me, right? You have to be cognizant of that. Your copays, how much is the copay to go to certain providers, certain specialists? What is your premium? What is your deductible? If you have a job that provides insurance coverage, is it just you on the plan, or do you have family members on the plan as well? Your out of pocket maximum, is that an individual maximum, or is that your whole family maximum? So if your out of pocket maximum for the year is $10,000, is that just for you? Is it just for one person to meet $10,000, or each one of you on the plan have to meet a 10,000 maximum? So those are the things that you want to pay attention to. What are the limitations? For example, if they're gonna pay for nursing home, are they gonna pay for nursing home for like 30 days out of the year, or are they gonna pay for 60 days out of the year? So things like that you want to be very, very aware of, and you want to be you want to know about them before you need them. Um, don't just choose health insurance because the premiums, your monthly payment is like $10. Yeah, somebody who's paying $10 is different from somebody who's paying, 15 $50. Again, focus on what is it that they have to offer. All right. And advocating for yourself, again, this is very, very, I can go on and on about advocacy. Advocate for yourself, or choose an advocate who is going to walk the journey with you. So for me, as an independent health advocate, what I do, part of what I do is I educate patients, right, on like their diagnosis. For example, I had a client the other day who recently got diagnosed with fatty liver. Now, the provider just told her she has fatty liver. Okay, so she started Googling. A friend of hers told her to reach out to me. So what we did is I went ahead and explained to her what that is, what fatty liver is, um, how can we manage it, the complications that could result as a result of that could happen as a result of the diagnosis of fatty liver. How can we prevent those kind of complications? So things like that, an independent health advocate can help with. I also help with care coordination, or like emergency. Say, for example, you go to the emergency room. You're someone who frequents the emergency room, or even if you're not somebody who frequents the emergency room, it's not unusual for people of color to visit the emergency room and you get turned down, or not necessarily turned down, but they tell you, kind of overlook your symptoms, or tell you there's nothing wrong, or they couldn't find anything without fully investigating the symptoms, right? So things like that, you want to make sure that you're standing up for yourself, or at least have somebody who's going to stand up for you. Okay. Do you have any questions so far, Miss Sandra?
Yeah, as I'm sitting here listening, I'm hearing it over. There's like three or four things. So I'll start with the first thing. As I'm sitting here listening, I'm hearing from you what I've heard, and what the patients and what the community overall who is watching these videos and taking in the information that is being spoken is this: we have to do better.
Mm-hmm.
Each of us has a stake in our healthcare.
Certainly.
Yes, we want you to actually be able to have the best health outcomes, but
Mhm.
we as a community organization, as an independent advocate, as a doctor, as anyone, we each have roles. We're each stakeholders, but the biggest
Mhm.
stakeholder is the patient. The biggest
Absolutely.
stakeholder and the biggest factor in all of this is the patient. So as a patient, you have to be invested in yourself. You only get one life. And as much as people have, like I said, the speakers have each said in their own way, they've said the same thing. Patients, we got to do better. We can't, and us as healthcare professionals, what we can't do is we can't sit back and hold the gift that we have, the knowledge that we have in reference to healthcare. We
Mhm.
can't sit and hold it back and say, well, I'm only going to give it to this, or I'm only going to give it to this person. We've got to actually all get on board and help each other. We've got to stop waiting for the healthcare hero to come save the day, come make changes,
Mhm.
because it's not going to happen. And so I've heard that today from you as well, Dr. Keefe. We have to, right? We got to do that personal commitment. We, as
Mhm.
whatever role we're in, we got to do that personal commitment.
Mhm.
And for healthcare providers, it's helpful to actually do that personal commitment with the patient and say to yourself, okay, I'm personally committed to getting my patient the best health outcome they can have. How do I do,
Absolutely. Mhm.
right? Let
Mhm.
me start by doing, by getting a plan together for your
Mhm.
patient. And no patient is the same. So we're
Yep.
going to need we're going to need individual plans, but find a
Absolutely.
way to figure that out. I mean, I know that, okay, you like Sandra, you talking, but you don't understand. We don't have time to do all that. So you go back to my point number two, which is what you brought up, which is patience. Know your health care. Know your health. Know your family's health. I
Mhm.
brought to you earlier, day one, I brought to you Renee Patterson, who has a program. It's a digital program. It's online, and you could go in, you could put your information in there. You'll always have it. It's in the cloud. I've created a personal health planner and journal, which you can keep your information in. You can keep your you keep your information. You can keep your family's information in, because knowing your family's health is very, very important to knowing your own health, right,
Mhm.
Dr. Kafilat? It's really
Absolutely.
important that you know what your family health is. And
Mhm.
you might be looking and saying, but Sandra, I was adopted. As I so often tell people that tell me that, when I say know your family history, and they say, well, I was adopted, so I really don't know what my family history is. You do, because your cultural history
Yep.
actually is a leadway into what you might be prone to. So when you have these symptoms and you have these signs, when you're going through preventative care or whatever other care you're going through, stop and think and say, what is in my culture? I'm
Mhm.
adopted, but what's in my culture? What I mean, that's how you actually really have to look at it. And looking at it in that way allows you to build up your personal commitment to taking care of yourself. Once you gone, you gone. You're
That's it.
gone. You
Just
you
one
can't.
life.
Right. You can no longer say, I didn't know, because
Mhm.
I'm sitting here as one person individual with my foundation. Dr. Kafala has another foundation. Renee has another foundation. You're going to hear, this is day 6. You're going to hear 24 other resources that you can reach out to. And each of them have a personal commitment. And I know they have a personal commitment to making sure that all patients are taken care of. But particularly for this month, we're focusing in on the African American community and what resources are out there and where people can go get those resources, because this information, they're giving it to you from their hearts. They're not charging you for it. They could be charging you thousands of dollars to get this information that you're not getting. because no one's talking to you. We're talking to you this month. We're sharing this information with you. We want you to take and share it with others in reference to that, because once again, that goes into your personal commitment. Take the
Absolutely.
time. Healthcare is no longer healthcare. Healthcare is a business. It's been a business for the past 20 some years, right? We got to get over saying the doctor don't have time for me, because
Hmm.
technically no business really has time for you. They have
Yep.
time for your money, but they really
Hmm.
don't have time to concentrate on you. So what
Right.
do? You need to be going to the doctor's office prepared. You need to be talking, like Dr. Kafilat said, you need to be advocating for yourself. You need to be bringing that to the table. You need to be saying what it is you need. Dr.
Right.
Kafalat brought up another very valid point. When you go to the doctor and your doctor isn't asking you common questions like, well, how are you doing? What's going on? Are you exercising? How you eating? Points like that. When they're not asking you those questions to bring that out of you, you really need to be sitting down and saying to yourself, is this the medical provider that I need?
Mhm.
Talk to that provider. Ask that provider these questions. If they're unable to answer them, or if they answer them but they're not answering them to the way that you want them to answer, look somewhere else. You got 1,000,001 doctors, 1,000,001, right? The last thing we want, especially our African American community, that we want is for you to go to a doctor where what they say don't even hit one ear to go through it, because you done already turned them off the minute you went in the office. You
Mhm.
only there because you there to pick up some medication and you need them to refill your prescription, right? Dr. Kafalat, you
Yep.
see it, I'm sure, right? To pick up a prescription, but
Yeah.
the minute you leave there, out of sight is out of mind. So you ain't gonna
Mhm.
listen. Who that hurting? That's not hurting the doctor. That's not hurting anybody
Exactly.
on that medical team. That's
But
hurting
you.
you, your family, and your
Mhm.
friends. Most importantly, your community. We
Yep.
all need you here in good
Mhm.
shape, in good physical and mental capacity. We need you here. We don't need you to
Absolutely.
be somewhere struggling on your own or doing things you have no business doing, because we know it's going to be harmful to your health. So
Mhm.
with those
Thank you.
things, I thank you, Dr. Kafalat, for coming in, taking the time out of your busy day, for spending some time with us, going over these points, and saying, look, guys, this is what preventive care is. Here are some steps that you need to be taking. This is what we really need to be concentrating in on. We want everybody to, get not just better health care or better health outcomes. We need to have you getting the best health outcomes. And
Right.
this is how you do it. These are the steps you need to take in order to get there, especially when it comes to preventive health care. And we all need preventive health care to me, Dr. Kafalat. And tell me if I'm wrong, right? Preventive health care to me, and I'm a big component, I'm a big, big, big person on this, is, in other words, it's called proactively taking care of your health, right?
Absolutely. Yep.
Boy,
Proactively, because it's a lot easier to it's a lot easier to prevent than to fix, right? Prevent problems
exactly.
from happening, than
Exactly.
fixing it after after.
Right.
And a lot of things that I find with our community too, over the course of the years in my practice, is that you know we we leave our health. I'm not saying don't trust your providers, but it is your health. It's your life, right? And then we hand it over. They prescribe us metformin. They prescribe us all this other medication. Now, there's some medications that don't work as well in African Americans compared to other race, right? So if they're prescribing you medications that does not work for your race or for your ethnicity, and you're taking it, you go back 3 months later, and your blood pressure is still elevated, and then they add another medication on top of that. Whereas if you had advocated for yourself, I know your provider should know this, but trust me, they have a whole lot of patients to look out for. You are you. You matter. So things like that, you want to be on the you just want to be on the forefront for it. Again, it's your health, it's your life. You have to know how to advocate for yourself. And if you don't know how, please learn. Learn,
I'm gonna
learn,
say
learn,
before it's too late.
learn,
Take that
learn.
take that proactive step before it's too late. Because
Mhm,
once you're gone, you're gone. Once you're gone, you can't come back and say, "Hey,
mhm,
you know what? I should have did this, or I could have did this." You can't come back and say that because it's too late. And the final thing I want to actually add, which is really important, that we continue to hammer this home as we continue to go through the month, is this: be transparent with your
mhm,
medical providers. This goes to all patients. If you're a caregiver, if you go into the doctor with somebody, whatever, if that central focus is on the patient, getting that patient better. But if you have information that you know that the doctor needs to know, that the clinician needs to know,
mhm,
whoever it is that they're seeking medical treatment from, that they need to know. If something should happen to that person because you didn't open up your mouth, they didn't say anything, and you sitting there knowing that they ain't telling the truth or not telling, all of the truth, right?
mhm,
Something happens to that person, you are responsible because you knew and didn't say anything, or you knew and didn't encourage them. Go ahead and tell the doctor, tell them everything, let them know everything, because there are tons of medical errors being made every
Yep,
day, all day, all across the world. So it's not
absolutely.
just in United States, it's a global issue. Medical errors are global issues. Yes, some doctors is responsible for actually making that medical error happen. However, patients who are not transparent with their
Mhm,
providers are just as guilty as the providers who know and don't do better.
mhm,
We are losing way too many people. Way too many people. I mean, COVID and her family, when they came in and set up shop in our lives and said we leaving when we get ready to leave, and they haven't really gone away yet,
mhm,
was one
mhm.
medical error, caused medical errors to be actually highlighted and brought to the surface so that everybody could see what was going on. But it's not just on the provider's end, it's on the patient's end. You go to the doctor and you don't tell them the whole truth,
Mhm.
or you sitting there with the patient and you know that they ain't telling the truth, and you're
Right.
not opening up your mouth. I would rather my friend get mad at me after
Mhm.
we leave the appointment and say, why did you tell him that, so that I could address my friend, if that's really my friend. I would rather that happen than me to just silently sit there and not say anything, and then they be given the wrong medicine or the wrong durable medical equipment
Right.
or anything for their health, and it's dangerous to them. We got to do better. Yes, we are
Mhm.
our brother and sisters keepers, especially in the African American community. We
Mhm.
are our brother and sisters keeper. So if we know what they're not saying, then yeah, we need to speak up. We need to take the chance that they ain't gonna be our friend. Because technically, if they're not gonna be our friend because we spoke up and got them the help that they need, ask yourself, was they ever really a friend?
A friend, right? Exactly.
Right?
Exactly. And sometimes people also worry about what their providers are, what they're gonna think about them, or if they're gonna be judgmental. Let me just say, for the most part, we don't. You're telling us stuff. If you're telling us, for somebody who smokes heavily, and you're saying, "Oh, it's just one or two cigar a week," most of the time, providers know that you're lying. So don't even worry about. Don't even worry about people being, being judgmental, because if you think that you're drinking two bottles a day, if you think that's, oh my gosh, I can't even get that out of my mouth. There, we've seen somebody else who has drank a lot more than you, so it's not going to
Mhm.
be the end of the world. We've seen a lot more than whatever you're going to tell us. So go ahead and spill it so we can know how
Right.
to take care of you. You know what I mean?
Yeah, and go ahead and right, and go ahead and spill it early, being proactive, getting that preventive care where you don't have to actually then turn around and go to a specialist for any reason. You don't need to be in a special hospital, or you don't need to be, it's out of control and there's really nothing that you can do. Be proactive about your health care. Please be proactive. Please do what you need to do to work in that preventive role, doing whatever you can. Once again, Dr. Kafilat, when you said it, you don't even really have to go walking. You can actually lift up lift up a can or a cup or whatever. You
Mhm.
could sit in your chair and do move your legs a couple of times.
Yeah.
Walking your legs. You ain't really got to get up. But there's
No.
all different types of ways that you can
Mhm.
exercise. There's all different
Even your
types of
arms.
ways.
Raise your arms up
Right,
and then go like that, like
right,
this.
right.
That's a form of
Exactly.
exercise for
It's
some people.
exercise. That's called exercise. And that's what we need to do. Dr.
Yeah.
Kafalat, before we close out today, what I do want to ask you is, do you have, and I know before I close out, I did want to actually bring up another extra point is this. I know that from reading your bio, were you born in Nigeria, or, right? So
Yep,
you
I
were
was born
born in
and
Nigeria.
raised in Nigeria.
Okay, so how do you get a chance to go back often to Nigeria?
Yeah, I do. Not as often as I would love to, but I
Hmm.
do. I do still go back, and in my advocacy business, we help people not just in the United States but also abroad. We are collaborating with the World Health Organization to bring empowerment and knowledge to folks all over the world, especially in the African continent. So yeah, it's
And so my
pretty exciting.
question to you, well, I'm excited for you, and I'm glad I asked that question, and I asked it for this reason. So, as far as the preventive care,
Mhm.
is it the same issue in the other countries, especially the African continent? Is it the same issues that they have there as far as their patients are concerned with preventive care, or is it different? Because in Africa, with the weather being as it is, they have a lot more chance to actually be outside, being able to get in the fresh air. They have a lot better access in some cities, or some states, I should say. They have a lot
Mhm.
better access to being able to get the fresh foods, the fruits, the vegetables. So are they experiencing the same level of preventive care, or is it something totally different?
It's different from a standpoint of not having as much access to healthcare like we do here in the U.S. or in the Western world. However, the healthier we back in most African countries, we do live a healthier lifestyle, from going from the food, the healthy food. A lot of the preservatives don't exist in our foods, right? And most people don't eat processed foods. It's all freshly made and things like that. And less access to like cars and to like mode of not that there's no cars or anything like that. There is, but people walk more, right? People are more in tune with, maybe they don't fully understand why they're doing it. However, like they are more in tune about themselves, but within their community, but not necessarily, having a lot of hospitals to go to for like check-in and things like that. So yeah.
Okay. So once again, I bring it to this point. The preventive care is not just an American issue. It's a
Nope.
global issue. There are patients, that need and suffer all over the world, that live in under-resourced areas, that, they might not have an opportunity to, take the bus or the car or Uber or Lyft or one or the other, car services, they might not have the money to do that because they're trying to live, right?
Mhm.
Which is why we all need to band together, not just here in the States, but we need to band
Mhm.
together on a global basis and push preventive care.
Yeah.
Show, while even in the United States, different geographic areas are going to have
Mhm.
different preventative issues going on that need to be addressed. We need to
Absolutely.
actually get to the point where we break it down geographically here in the United States as
Mhm.
well as globally across the world, and make sure that we're helping patients in whatever we need to get done to make sure that we all, each of us, because as I often say, the least of us should have access to the best of us. We might not, they, might not use it, but the
Mhm.
point is they have access to. Give them the
Mhm.
resources, allow them to have the option that if they wanted to get the best health care, they could get it. And this is a
Absolutely.
country, this is across the continent. So with that
Mhm.
being said, and thank you so much for addressing that and bringing up
Absolutely.
the
My pleasure.
information with reference to the work that you're doing with the World Health Organization to actually see, be there, make that difference. Not just talk the talk, but
Right.
talk and walk at the same time so that patients across the country can stop actually, just not having, just continue being under resourced
Yeah.
and vulnerable and all the negative words that actually impact our community. We
Mhm.
thank you so much for all of the work that you're doing. With
Thank you.
that being said, is there any final takeaway point that you would like to leave us all with?
Remember that you matter. You are beautiful. You are awesome. You are you're better than what the world think that you are. The limitations that the world has put on us is not who we are. We're beyond that. You can achieve anything that you set your mind to, whether it's health goal, whether it's, financial goal, whatever it is, you can do it. You can do it. You can do it. Don't let the world tell you otherwise. You're awesome. You're perfect the way you are. So just, keep going, keep striving. We're going to meet at the top. And for I do also I want to point out that my social media handle, I do offer some I post different health contents. I post Monday through Friday. So if you want to catch any one of those, follow me on Instagram. I'm on Facebook. Yeah, learn how to advocate for yourself. Learn some things, one or two things. I promise you learn one or two things if you visit my page. So. Uh, Last month, January, we went over, cervical cancer screenings and what to do to prevent it, to catch it early. So again, you're gonna always find something to learn about. So advocate for yourself, empower
I
yourself.
attest to the fact that you're always going to learn something from Dr. Kafilat's Fides page. You will always, she's always
Thank
putting
you.
something out there because she's has that passion within her to make a difference. So she
Thank you.
puts that information out there. She says Facebook and Instagram, but she forgot to mention LinkedIn because she is also she is also on LinkedIn, and I'm
I'm
waiting for
noisy,
her
y'all.
to look. That's a lot. I'm waiting for you to hit TikTok to bring it all the way live. I'm waiting for you to hit TikTok. I'm sure you're gonna be there because I'm sure that's on your list of okay, I got all of these. I need to get this.
It
To
is.
reach as
It's a
many
lot of work
people
though.
as you possibly can. I so appreciate you from the bottom of my heart, as well as from the board members that serve on the Chalmers Medi House Foundation. We thank you so much for
Thank
just
you.
giving of yourself, and we wish you continued success. We looking forward to that continued collaboration between the two foundations and two organizations. Together we rise. So thank you
Yes.
so much.
Thank
Enjoy the
you.
rest
Thank
of
you
your
for having
day.
me. Really, it truly is an honor. Thank you. Thank you. I appreciate you.
You're
I appreciate
welcome.
this platform.
Have a good one.
You too. Bye bye.